Well, Health Minister Dr. Zweli Mkhize says the possibility of a third and fourth wave can't be excluded. He believes human behaviour is what will determine when South Africa gets its next waves of the COVID-19 virus. The Health Department says there's no mathematical models to help it establish when South Africa will experience its next surge. In fact, let's take you straight to the Minister who's joining us tonight. Good evening, Dr. Mkhize. It's a pleasure to have you on the show. We speak at a time when many South Africans are feeling quite hopeless and quite frankly pessimistic about government's plan when it comes to vaccinations arriving in the country and beginning the rollout in earnest.
Yes, certainly. I think we must all understand why South Africans would be anxious. We have just come out of a very devastating second wave, and all of us have actually felt it personally affecting us in terms of people we know, colleagues, family, relatives, friends. And so I think it's a realistic situation that we're facing where we're saying that everyone out there is quite nervous about it. And I believe, therefore, that the anxiety is understandable. I think I'd like to just explain two issues. The first issue is that the third wave or any subsequent waves, we cannot predict with certainty. We can only just extrapolate from the behavioral pattern and suggest that this may well be the time. But that's one issue. The issue is that even if we're to do all the vaccination right now, you cannot still say that people will be safe from the effect of the wave, because we won't complete the vaccination, and we need to actually do both, use our containment measures and use of masks, hand washing and distancing for the whole of this year and probably even beyond, until we can see the numbers have come down, even though we would have actually done the vaccination. The vaccination prevents severe, mild, moderate, severe illnesses, hospitalization, and reduces death. So that is what the vaccine would do. But someone who would still be vaccinated can still contaminate the surfaces and actually help to spread the infection. So it's important for us to understand that we all need to focus on the vaccination from that point of view. It's only when we've got a huge number, a critical number, that you may actually have people who are not vaccinated getting protected through what we call population immunity. So those are the situations we're dealing with. We just have to continue with all the preventative measures, because we don't know what the pandemic is going to be, how it's going to behave.
Of course, the difficulty, Minister, is that people can't even think about vaccines because we don't have any.
Yes, we do have some vaccines, but let me just explain again what we had actually initially said. The initial plan we had raised was that we were going to start the vaccination in February, and we're targeted to raise 500,000 of the Johnson & Johnson vaccines and about 600,000 of the Pfizer vaccine for the month of February and March. Now, we've actually been delayed by some of the manufacturers who have not been able to provide us the vaccines as we expected. But the reasons for it, one, on the Johnson & Johnson, the delay is because the vials, the vaccines that we're using were actually recalled from research batches. So to get them from different countries, it actually needed quite a bit of authorization from some of those countries. So that's caused a bit of a delay. Secondly, Johnson & Johnson will only start from their own manufacturing batches to deliver the vaccines by the second or third week of April. So that's what they've given us. So we are going to be getting more vaccines coming from April, May, and June. And those 3 months, we expect 2.8 million vaccines from Johnson & Johnson. From Pfizer, we expect to sign the contract. We've actually had been quite delayed with the negotiation on the contract, but we have a 20 million batch that we expect 7 million to be delivered before the end of June. So all in all, we should be between April and June have about 10 million vaccines that should be available to South Africans. So we'd still like to ask our people to be very patient because yes, it's a bit frustrating because we all are rushing to get the vaccines, but at the same time, we do understand that it's all linked to global supply chain delays, and so that will affect us every now and again.
Of course, the other issue that affects whether or not people trust what you're saying, Minister, even in terms of the numbers that you've just given us, is that there seems to have been very little transparency on the part of the department when it comes to what government's vaccination plan actually entails. So we speak broadly about these contracts and negotiations that are taking place. We don't know what is being discussed. There is no disclosure over even how much South Africa is going to be buying these vaccines for. Do you not think that it's time that government begins to take the South African public into its confidence and give us more details about where we actually realistically are when it comes to government's procurement of these vaccines?
Well, what I can say that insofar as the prices associated with this, the Pfizer and Johnson & Johnson, some of their prices have been public, and they're around $10 for Johnson & Johnson and about between $10 and $15 for Pfizer. Once we have got the matter concluded, we will then announce this is the amount we paid. Because we've concluded the agreement, then we can announce a figure. So the indication that we're giving is just to make sure that South Africans do have a sense as to where things are. But once we've got that finalized, we're then able to publicize it. Secondly, we did indicate that on our first phase, we're going to take 3 months, and we have not really finished the 3 months, although we wanted to push it faster than that. For the second phase, we're going to take 6 months. We have made this also very well known as well. We've also indicated that on the first phase, we're only targeting 1.2 million health workers, and then on phase 2, we're targeting 16 million South Africans, and of course the last phase, which would be over 20 million, will be after that, which would be after the 6 weeks of the second phase. So there's quite a bit that we have shared with the public. I think it's important to just remind people every now and again on what we have done. In terms of the transparency, there are principles which we have shared. We have said that, for example, what are we negotiating with the various companies? We're negotiating the issues of the payment terms. And here we've said that all of them have come with a condition of prepayment, which requires a lot of discussion with Treasury to get deviation. We've also discussed the issues that relate to the delivery schedule. In our case, they've only been able to say once you sign the agreement, they can give you quarter by quarter a delivery. That's why I gave you the numbers that I've given. So the quarter to quarter numbers will only be improved once you have actually got the delivery process starting and the agreements having been finalized. So that's the other issue. The third issue that we have discussed in relation to the various companies are, the issue around the delivery schedule. They've always wanted to make sure, and this is for all of them, that look, even though we've tied ourselves up to a particular volume for distribution at a particular time, for delivery at a particular time, but please be aware that we might change that if there are constraints, if there are delivery challenges, if there are blockages in manufacturing, if there are equipment breakdown and all of that. So we negotiate quite a lot of that because we fight about it, because we would like to get a situation where we can put penalties if somebody doesn't deliver. The other point that we have actually had to discuss is about what we call indemnity, where most of the manufacturers would like the government must actually take responsibility for the effects of adverse effects that will happen to the vaccination process. Now, this raises a lot of debate, and therefore it's taken us quite a long time to settle on those issues, but it's a condition that's happening in all the countries all over the world. The last one is got to do with a compensation fund, which basically looks at if somebody has had some harmful effects from the vaccines, where do they claim? And therefore, we need to provide such a mechanism. So those are the key issues. Now, what we can't divulge is this is where this issue is, but we can tell you in principle, those are the key issues that are part of the negotiation. So I think it's important to say that there is an understanding of the issues involved, even though we would then come back and say, here now is the agreement, these are the specifics on that particular issue. But the principles are what I've just indicated. We've shared these in public, and I think it's important to just repeat that if there's a feeling that people would like to know exactly what are the issues that are involved in these issues.
We'll continue our conversation with the Health Minister, Dr. Zweli Mkhize, after this quick break. Do stay with us. We continue our conversation tonight with Health Minister Dr. Zweli Mkhize. Minister, just before the break, you were telling us about some of the difficulties that the department has been facing in terms of giving the public information. When we look at what some of the experts who work in this field are saying to us is that right now there doesn't seem to be a sense of government being realistic in terms of just even how you see the vaccine rollout plan taking place once vaccines arrive in the country. And when we look at the Johnson & Johnson implementation study as an example, the difficulty in getting the vials here and just the administration that is involved in that, is government confident that there won't be similar delays when it comes to the actual rollout of the vaccine in the country? And are you accounting for that?
Yes, let me say that the 500,000 from Johnson & Johnson, we were aware that we had to actually mobilize it from various parts of the world. Unfortunately, some of the delays may not have necessarily been anticipated. For example, the delay in the approval of the release of those vaccines. But all the contracts that we have got what is called force majeure, which means if there are situations beyond their control, there may be challenges. But what is nice about the Johnson & Johnson is that most of those vaccines would actually come from Aspen plant in South Africa. So we believe, therefore, that we'll be able to see how things are happening, because it will be happening within our shores. However, throughout the whole, in fact, for most of the continent, they would be supplying, which is for us a very good, is good news that way. But let me then say that it is possible that there may be delays, but from where we sit, we are fairly confident that the flow will be much better, because if you look at it, there's nowhere where Johnson & Johnson has started supplying. They've given us these vaccines, but South Africa was the first country to start using Johnson & Johnson in the implementation process. So most of them would have, most of their plant would have started manufacturing in March, and therefore would start delivering stuff around April. So we're fairly confident on that one. And also we have actually looked into the ease with which Johnson & Johnson is actually going to be stored as well as transported and administered. It's actually very advantageous for South Africa. So we've actually put additional discussions, just that we can't announce the amounts, but we've put additional orders to make it easy for South Africa, because we believe that the location makes it more secure for our purposes. Of course, if there are any challenges, we expect that we would have a knowledge of that before things do go wrong.
Minister, in the absence of these vaccines, we now are approaching Easter period, and you would have seen the warnings, and you yourself have spoken about it, about how we can't predict when a third or even fourth wave will hit the country. Are we looking at a situation where, yet again, South Africa is going to have to go into stricter lockdown restrictions, because as it stands, we don't have any other options in terms of immunity that the population has been given?
Well, unfortunately for the rest of the world, that's going to be the situation. There will be vaccination programs. There will still be another wave and possibly another one after that. If you look at the UK, they were in the process of vaccination, and they actually had a huge upsurge. And therefore, we must anticipate that will happen. It will not be this year where the vaccination will actually stop a wave. It might be a bit later than this year, and probably maybe latter part of this year for some of the countries. But it's not unusual that whilst the vaccination is going on at a rapid pace, there will still be another wave of the pandemic coming up. We've seen it happen in other countries, so I think we must not believe that we will be different to other countries. The issue, of course, for us is that as soon as we get the vaccines, we need to move and make sure that they are administered as quickly as possible and to as many people as possible. And to that we are committing ourselves as government. We shall continue in that line. And as far as we would be concerned as well, it means that we need to continue to send the message that we must use masks and hand sanitizers, hand washing, distancing. For most of this year, we still have to use it because the point at which we will say we are safe is still a bit far, even if the vaccination would have started.
So, Minister, will we see tighter restrictions over the Easter period?
That matter is under discussion from the National Coronavirus Command Council. There's quite a lot of issues to consider, and therefore I'm not at liberty to say until those decisions are taken. As far as I'm aware, that process is really a combination of various considerations. There are calls for very tight restrictions. There are other people who are saying, well, let's keep the restrictions low. That was always going to be a kind of challenge we are going to have to manage for a long time to come. Ideally, government wouldn't like to see any restrictions. However, if we have to prevent the loss of life, there's to be actions that are taken. At the same time, we'd like to see people back to normal life and normal economy. We do appreciate that people feel the constraint and have to make the sacrifices, but it's only on the conditions when we know we no longer can do anything else to protect the lives of our people. We have to actually take certain steps. So that's really how it comes about. It's not so much that, well, there are no vaccines, so we're going to go into that's a lockdown. It's really because for a period this year, we will still need to balance the issues of containment measures with the incidence of the pandemic as it manifests itself in different ways.
One of the leaders of the Ministerial Advisory Committee has come out publicly to say that, you know, he recommends that there is a stricter lockdown implemented. I would imagine that the committee has given you those recommendations, Minister. So are you going to be acting on those recommendations? And if you have not received them yet, what are you proposing to the National Coronavirus Command Council for the Easter period?
Well, we have received that advisory. We've debated to quite a long extent with the Ministerial Advisory Committee. As far as we would be concerned, there are many other factors to take into account. For example, the President called a meeting of religious leaders and went for a consultation with them. Then before the decisions are taken, the President calls a huge amount of, a huge consultative process involving the provinces, the premiers, the MECs, the traditional leaders, and a lot of other stakeholders at NETLEC and so on. And out of that, to try and get a combination of what would represent the best interests of South Africa. So Ministerial Advisory Committee is very, very important, but we always look at a combination of a number of issues. Once you've balanced them all up, then we can come with a decision. So it is never just a once-off issue with one particular team that would say. What we take into account the principles, the scientific principles behind their decisions and their advices. But once we engage, you find sometimes that we can come to a different conclusion, engaging with them or engaging with other partners. So I think at this point, we should wait for the process, the consultative process. It's always been done that way from the beginning, and that's because we are always very conscious of the sensitivity of having to take a decision that might have an impact on the restriction of the rights of society. And from that point of view, we should then be able to say, we have taken all the issues into account, and out of that, this is the best we can say represents the best interests of South Africa.
Of course, Minister, while the country is fighting this pandemic and you are leading this cause, there are calls for you to step down over the revelations about the awarding of a contract, a tender from the health department to your close associates. Have you heard of those calls, and have you considered at all the possibility of stepping aside while the SIU conducts its investigations?
Well, the issue was raised in Parliament and we responded to it, that we are committed to the fighting corruption. We actually had received reports prior to all the newspaper reports, which required us to advise the Director General to investigate the matters and use external independent investigators to take the matters through. So while that process had started, of course, the SIU had become involved. So right now, as far as we would be aware, all of those investigations are going on without any problem, and we therefore don't think that there's any way those investigations could be interfered with. I wrote personally to the SIU and indicating that we're willing to offer as much cooperation and documents and make everyone available for discussion, for interviews with them. They came back and actually asked for specific information, and certainly there's no interference whatsoever with the flow of the investigation.
Do you think it's ethical for you to still be in this position, however, while this investigation is taking place? And I mean, we can just look at the example of Gauteng, where the former health MEC, Dr. Bandile Masuku, also faced with a controversy, you know, stepping aside while the work of the investigators was continuing.
Well, there were certain issues reported by the SIU that brought the matters to that kind of level. I think that in this case, we should just wait for the report and then deal with the issues after that.
Yes, but do you think it's ethical?
Yeah, I think what would be unethical would be if there's any way there's any interference with the investigation. But the SIU and all the investigations that are going on have been flowing on without any form of any challenge. I don't believe that there's any challenge in it.
The Health Minister, Dr. Zweli Mkhize, thank you for your time. We're going to leave it there for tonight right here on News at Prime.